Good morning, everyone. Today, we're diving deep into a crucial aspect of our work, premature birth. This isn't just about clinical care. It's about understanding the risks, recognizing the warning signs, and caring for our tiniest patients and their families with compassion and expertise. Premature birth, or preterm birth, occurs when a baby is born before 37 completed weeks of gestation. This early arrival can lead to multiple challenges because many organ systems are still developing. Every extra day in the womb contributes significantly to lung, brain, and immune system development. As nurses, understanding the correlation between gestational age and outcomes is key to providing the right level of care. Several maternal factors increase the risk of premature birth. These include medical conditions like high blood pressure, gestational diabetes, and thyroid disorders, infections such as urinary tract infections and bacterial vaginosis, lifestyle choices like smoking, alcohol, and illicit drug use, and nutritional deficiencies that may compromise the pregnancy's progress. Pregnancy-related factors include multiple gestations, which means carrying twins or triplets can increase stress on both the mother and the fetuses. A short interpregnancy interval, which can reduce the mother's recovery time. Placental issues such as placenta previa or abruption. And cervical insufficiency, where a weak cervix dilates prematurely. History matters. If a mother has experienced preterm birth before, her risk of another premature delivery increases, emphasizing the need for close monitoring and intervention. Preterm babies often suffer from respiratory distress syndrome, RDS, because their lungs lack sufficient surfactant. They may require supplemental oxygen, continuous positive airway pressure, CPAP, or mechanical ventilation in severe cases. Other respiratory concerns include apnea and the risk of bronchopulmonary dysplasia. Due to an underdeveloped suck-swallow-breathe reflex, many preterm infants need tube feeding or parenteral nutrition. Additionally, they are at risk for conditions like necrotizing enterocolitis, NEC, a serious intestinal infection. Brain development in preemies is critical. They face risks like intraventricular hemorrhage, IVH, and long-term developmental delays, including learning disabilities, motor skill issues, and an increased chance of cerebral palsy. Additional risks include jaundice due to immature liver function, infections from a weak immune system, and retinopathy of prematurity, ROP, which can impair vision. Maintaining thermal stability is critical. We use incubators, radiant warmers, and practices like kangaroo mother care to ensure proper temperature regulation. Preterm infants often require specialized respiratory support. Whether it's through CPAP for those with moderate distress, or more invasive ventilatory support for the extremely preterm, our role is to monitor oxygen saturation, adjust settings as needed, and collaborate with respiratory therapists. Feeding preemies is a delicate process. Initially, we might use total parenteral nutrition, TPN, until their gastrointestinal systems mature. When transitioning to enteral feeding, careful observation for tolerance and signs of NEC is paramount. Breast milk is always encouraged due to its immunological benefits. Strict infection control measures cannot be overemphasized. Every hand wash, every sanitized instrument, and controlled visitation policies play a role in reducing the risk of infections that preterm babies are particularly vulnerable to. Parents of preterm infants often experience anxiety, guilt, and uncertainty. It's our responsibility to provide empathetic support. This involves regular updates on their baby's progress, counseling sessions to address emotional stress, and connecting them with support groups or counselors specializing in neonatal care. Before discharge, we ensure parents are well informed about feeding techniques and schedules, recognizing warning signs, maintaining a safe, hygienic environment at home, and scheduling follow-up appointments for developmental assessments. Encouraging parental participation in care, such as performing skin-to-skin contact, builds confidence and strengthens the bond between parent and child, which is essential for the baby's development. In this case, the infant was placed on CPAP immediately. We monitored oxygen saturation and adjusted the settings in coordination with the respiratory therapist. Our timely intervention stabilized the infant's breathing and prevented further complications. I understand how frightening this is. We're closely monitoring every change, and our team is here to support both you and your baby. Let's review the progress together so you can feel more confident about the care your baby is receiving. Let's summarize what we've covered today. Recognizing the categories of prematurity is vital. Maternal health, lifestyle choices, and specific pregnancy complications play a significant role. Preterm infants face challenges ranging from respiratory and feeding difficulties to neurological and immunological issues. From temperature regulation and respiratory support to nutritional management and infection control, our actions are critical, and emotional reassurance, education, and involvement in care are as important as any clinical intervention. Thank you for your attention and dedication. Remember, every extra day in the womb matters, and every touch we provide here can change the course of a tiny life. I'm now open to any questions or thoughts you might have.